It's patients with unresected locally advanced squamous cell carcinoma of the head and neck. So patient with locally advanced disease. This patient has quite a poor prognosis, around 50% survival at 5 years, and around also 50% that will remain free of disease at 3 years. So clearly we need to do better for this patient. So we took this group of patients, unresected patients that were planned for chemoradiation. And the study indeed randomized 804 patients between chemoradiation plus pembrolizumab. Pembrolizumab is an anti-PD-1 monoclonal antibody versus chemoradiation plus placebo. We start pembrolizumab 1 week before chemoradiation. We gave 2 additional cycles during chemoradiation and 14 cycles as adjuvant treatment. So it was all comers. The primary endpoint was event-free survival. So event-free survival, it's going to capture death, progressive disease according to RECIST, but also a relapse that is diagnosed by pathology, because in head and neck cancer it's not all time easy to measure the disease by RECIST criteria. So the primary endpoint indeed in the trial was unmet, even if the hazard ratio is 0.83 and the p-value is 0.04. The reason is because the efficacy boundary was 0.02 in the trial. But if we look at the 2-year event-free survival rate, it's about around 53% for the control, and it's increased by 6 or 7% in the pembrolizumab arm. So a trend to a less event in the pembrolizumab arm. So when we do some other analysis where we select the patient for PD-L1, and when we are taking the patient with a high expression of PD-L1, 20 or higher, this is an exploratory analysis, we see a better improvement with pembrolizumab in terms of event-free survival, but also a trend or of better survival in this patient. So in the control, the 3-year overall survival was 73%, and in the pembrolizumab it was 79%, although this is an exploratory analysis. So I think that the trial is negative, but it sends a positive message that in some patients we could have a benefit of adding anti-PD-1, probably that PD-L1 the combined positive score could be one of the predictive biomarkers, but this needs to be validated in prospective trials.